Hello. Please join me in greeting Julia Melendez from Newport News. Julia has first-hand experience with the value of Virginia's Famis programs, first as the mother of 3 girls, and also as a Famis outreach worker. Julia, we are so glad that you were able to come here today to talk to us about the Famis program and how valuable it is and some of your experiences with it.
Thank you for having me.
Absolutely. So, Julia, tell us, how did you first learn about the Virginia's Famis programs?
I came to learn about the Famis program actually due to a circumstance or situation that I wasn't expecting. I was laid off and found myself without family coverage. And at that point, of course, I became a little concerned and worried and started seeking out information about how I can find some type of coverage to help my children. Then I spoke to a friend of mine, an acquaintance that lives in my community, that mentioned something about the state having a program for children. And she didn't really know where to access the information, so then I started doing my own little investigative process. And I went to a specific clinic in the city where I live and found a brochure. And then I started taking the steps to initiate contact.
That's great. And so tell us, what did you do what steps did you take to initiate contact?
Well, first, once I had the brochure in my hands, obviously I read through the brochure and kind of was weighing to see if I would actually qualify. And then I made the phone call. There was a number that was attached to the brochure and started asking questions. And once the representative that was on the line responded to those questions, I started then taking the steps to acquire an application, gather my documentation, and then complete the process for applying.
And so, Julia, I think you had mentioned that your girls have been able to have health insurance through the Famis programs for a good number of years now.
Yes, we've been celebrating many happy anniversaries with Famis, and I would say it's been approximately since 1998, so now it's been 10 years.
That's fabulous. And I'll bet there have been some times in the past 10 years where you've been especially glad that you had Famis.
Always, always. It's been, I call it like a friend of my family, having the Famis program as a part of our lives, because it has helped my children to stay healthy, be able to go to the doctor when they've needed to go to the doctor for just, general well-child checks, or when they've been a little bit sick with colds and viruses and things of that nature. And then there were moments when they really severely needed medical attention due to unexpected illnesses.
I remember you mentioning something about appendicitis.
Yes.
Tell us a little bit about that. That sounds very scary.
Yes, it was a very scary thing because, again, it being an unexpected situation for my middle daughter, Lisette, was in school, and all of a sudden I get this urgent call from the school nurse, and she is Miss Melendez. She's extremely sick. There's nothing we can do. I really have a feeling you'll have to take her to the emergency room. And when I heard that from the nurse, I already knew this is, something that was at a very severe level. And at that point, no questions asked. I picked her up, ran her over to Riverside Regional Medical Center, and found out through some of the symptoms she was having and the different examinations she was being given and different tests that it was an appendicitis. And they had to operate within that same time period.
And wonder what would have happened if you didn't have Famis.
My assumption at that point would have been, probably as a parent having concerns and fears about the treatment their children receive in a hospital when they don't have health coverage, I probably would have hesitated. I think that's the normal, natural reaction most parents have. Well, let me see if I can remedy this at home. Let me see if I can give them over-the-counter medication. I didn't think twice. I had Famis. I knew my child was protected. I didn't have to hold back. I didn't have to worry, because the minute, the person at the front desk of the emergency room asked me, does your child have health coverage? I said, yes, we have Famis. And at that moment, there was no concern, at least in regards to that part of the situation.
That's really wonderful.
Mm-hmm.
And so I remember you saying that your oldest daughter has just gone to college, or just went off, is now too old for Famis.
Yes, and that was a sad day. I reminded her, I said, well, Lucia, now you're turning 19, and you know what that means. And she goes, well, it means a lot of things. And I told her, no, but I'm talking about in reference to your health coverage. It will end this month. And it was a sad time because at this point, now I have to start doing many different things to try to see how she can remain healthy and find some other source to help, protect her when it comes to her health and her well-being. So it was a sad day.
So, Julia, when you have used the Famis programs over the past 10 years for your 3 daughters, have you noticed, were you treated any differently from the different doctors or dentists or other health professionals with whom you came in contact?
Not at all. And that was the great thing about it. The plans that are offered under the Famis program are plans that most individuals have that live in that community. Being the 3 plans, Virginia Premier, Anthem Healthkeepers Plus, and the Optima, many employers also have their employee benefits under those plans, under those companies. So it was basically a very easy transition to have the Famis program from having my employer coverage, and when I got laid off, to having the Famis coverage, the plans under the Famis coverage. And I didn't sense a difference at all. And we received the same quality care and attention. There was no indifference.
That is great, and that is what we hear from so many families. So it's good to know that was your experience as well. And then you moved. You actually moved and changed jobs and became a Famis outreach worker, so that you could start helping people learn about the program and enroll and learn how to use it. Let me ask you, what was the biggest surprise to you as an outreach worker?
I think first I felt very blessed that I got the opportunity to do this type of work. I've always enjoyed working with the community and with families and children, and always enjoyed, working with nonprofits, doing outreach. When I had the opportunity, I said, great, this is my opportunity to give back to a great program that has given to me and my children, that has helped us out so much. And what I found so amazing and ironic at the same time, that this wonderful program that helps families, helps children, not too many people knew about it. And they didn't have all the information, all the details, all the specificities. And that was what I found really, strange. I said, oh, how can it be? And it gave me more motivation and enthusiasm to do the work that I do, because I wanted everyone to find out about it.
A lot of times we see that there are families who are eligible for the program who really don't understand that at their income they could be eligible. Have you run into that?
I have run into that on many occasions, especially when the families are 2-income household families. They feel that they're not at the level income-wise that would permit them to be in the program, so most of the times they don't even make the effort to apply. So the many times that I've had the opportunity to do outreach and have encountered these families, I always try to motivate them and show them the income guidelines and give them the information and actually kind of guide them and support them in applying.
So what kind of families would these be? I mean, what kind of jobs would the people have?
What I found, a lot of these are families that work very hard and work with companies like Walmart and 7-Eleven, where the hourly pay is more than minimum wage, but not extremely high or high enough to make them completely independent.
And we've seen in a lot of parts of the state that it also includes people like police officers and other first responders who just can't afford the coverage for their children. Have you seen that?
Yes, I have seen that, and on quite a few occasions where we've even had teachers. I remember helping a family in Hampton with this program because the spouse worked a part-time job, he was studying, and the mother, the female spouse, worked for Hampton City Schools. And the income she was making from the schools, which she was very grateful to make, was not enough for her to be able to have afford family coverage and pay co-pays and deductibles and the many different things that it entailed.
Okay.
And it was great to be able to help them.
So if you were to give people advice on how best to apply, what would you tell them to do?
Oh, that's the greatest thing about Famis. It is so easy, access to applying in a variety of ways. So it gives the different windows that many families can go through in order to apply. They can do it by fax, they may be able to do by phone, and if they have access to a computer.
I actually think that we have the 800 number that we're showing on the screen right now.
Yes.
An 800 number that people can call, and the hours are listed there too when help is available. And so we encourage everyone to take advantage of that. Julia, I really want to thank you for coming here today and sharing your story and your insights so that other parents have the opportunity to learn and get insurance for their children. It's so important that we reach more families. Interested in learning more? Visit our website at vhcf.org.